Welcome back to our channel. In today's video, we're diving into a topic that affects millions worldwide: hearing loss. If you or someone you know is struggling with hearing loss, stick around because we're going to explore how to restore hearing loss fast with some of the latest strategies and innovations available. Let's get started. Understanding hearing loss. First, let's briefly understand the types of hearing loss. 1. Conductive hearing loss. This happens due to problems in the outer or middle ear, like ear infections or wax buildup. 2. Sensorineural hearing loss. This is caused by damage to the inner ear or auditory nerve, often due to aging, loud noise, or genetics. 3. Mixed hearing loss, a combination of both conductive and sensorineural hearing loss. Knowing the type of hearing loss is crucial because it determines the best approach for restoration. Immediate interventions for hearing loss. Let's talk about some quick fixes and treatments. 1. Medical treatment for conductive hearing loss. Earwax removal. Sometimes, hearing loss is simply due to earwax buildup. Professional ear cleaning can restore hearing almost instantly. Medication. If infections are the cause, antibiotics or antifungal medications can lead to rapid improvement. 2. Hearing aids and assistive devices. Modern hearing aids. Today's hearing aids are highly effective and can be quickly fitted and calibrated to improve hearing dramatically. Cochlear implants. For severe cases, cochlear implants can be a game changer. They do require surgery, but hearing can be restored soon after activation. 3. Emergency treatment for sudden hearing loss. Steroid therapy. For sudden sensorineural hearing loss, corticosteroids can reduce inflammation and improve hearing if administered promptly. Emerging technologies and innovations. Now let's look at some cutting-edge technologies making waves in hearing restoration. 1. Regenerative medicine. Stem cell therapy. Research is ongoing into using stem cells to regenerate damaged hair cells in the inner ear. This promising therapy could restore hearing without traditional aids or implants. Gene therapy. Scientists are exploring gene therapy to correct genetic defects causing hearing loss. Early trials show potential for restoring hearing by repairing or replacing faulty genes. 2. Neuroprosthetics. Auditory brainstem implants. For those who can't benefit from cochlear implants, auditory brainstem implants offer a direct way to stimulate hearing pathways. 3. Acoustic neuromodulation. Tinnitus treatment. This sound therapy can rewire the brain to reduce tinnitus, which often accompanies hearing loss, thereby improving overall hearing. Lifestyle changes and preventive measures. Beyond medical treatments, certain lifestyle changes can also make a big difference. 1. Diet and nutrition. Antioxidant-rich. Diet. Foods high in antioxidants, like vitamins A, C, and E, can protect ears from oxidative stress and potentially restore hearing. Omega-3. Fatty acids. Found in fish oil, omega-3s are linked to better hearing health and may help restore hearing by enhancing blood flow to the inner ear. 2. Hearing protection. Avoid loud noises. Protect your ears from loud environments to prevent further damage. Use ear protection. Wearing earplugs or noise-canceling headphones in noisy settings can help preserve and restore hearing. Seeking professional help. Consulting an audiologist or an ear, nose, and throat specialist is crucial for diagnosing the type and cause of hearing loss. These professionals can provide personalized treatment plans with the latest technologies and therapies suited to your specific needs. Restoring hearing loss quickly involves a multifaceted approach, from immediate medical interventions to cutting-edge technologies and lifestyle changes. Stay informed, consult healthcare professionals, and take proactive steps to improve your hearing health. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more health tips and updates. See you next time.